Good morning, everyone. Thank you for giving me the opportunity to speak to you today about sodium, about the importance of the DRI for the Centers for Disease Control and Prevention. CDC is the nation's premier public health agency, working 24/7 to save lives and protect people. CDC's mission is to keep Americans safe and healthy where they work, live, and play. CDC works to help people in communities prevent chronic diseases and promote health and wellness for all. High blood pressure is the leading cause of death from heart disease and stroke in the United States. And more than 75 million Americans, about 1/3 of adults, have hypertension, and fewer than half of them have it under control. Sodium reduction can lower blood pressure. CDC surveillance data show that 9 in 10 Americans exceed the recommended amounts as defined by the dietary guidelines for Americans, which, as Dr. Klurfeld mentioned, are based on the dietary reference intakes. CDC follows the dietary guidelines for Americans, and therefore DRIs are essential to inform our programs that prevent heart disease and stroke. In order to achieve our mission of saving lives and protecting people, CDC partners with state, local, tribal, and territorial health agencies on critical public health issues. CDC supports 8 grantees specifically to reduce sodium intake and to improve the availability of lower sodium products so that Americans can reduce sodium intake to levels that are in line with dietary guidelines. CDC also funds 50 states, the District of Columbia, 4 large cities, and select tribes and territories to promote healthy behaviors and reduce risk factors, including dietary risk factors associated with obesity, diabetes, heart disease, and stroke. CDC also led the update of the food service guidelines for federal facilities that were developed by the Food Service Guidelines Federal Work Group. The work group was composed of more than 60 representatives from 9 key federal departments or agencies. These guidelines aim to ensure that healthier foods are available and encouraged in federal facilities. These recommendations include sodium limits for prepared and processed foods, so will be impacted by the DRIs. Next, CDC's sodium reduction, same slide. CDC's sodium reduction initiative supports the Million Hearts 2022 goal of preventing 1 million heart attacks and strokes by 2022. To that end, Million Hearts has established a goal of reducing sodium intake by 20%. Reviewing the reference levels for sodium intake for sodium and potassium will help inform these efforts and improve the health of all Americans. In addition to our programs, CDC, in collaboration with other federal agencies, also, as Dr. Klurfeld referenced, monitors public health data, conducts surveillance of heart disease and stroke and related risk factors, including dietary indicators such as sodium intake. And to understand the impact of sodium changes in the United States, CDC will continue to work with partners on assessing the amounts of sodium in foods, consumer readiness to reduce sodium, blood pressure control, and heart disease and stroke mortality. And finally, importantly, again, as Dr. Klurfeld said, we received congressional direction to conduct this update. So we've been working with the federal agencies here today, as well as Health Canada and the Public Health Agency, to execute this contract to update the DRIs for sodium. And we welcome the opportunity to have this DRI and update with the best available evidence. Thank you.